Hi, my name is Jessica Morris, and this is my Nursing 480 project on transcultural nursing care across the Hispanic lifespan. Nurses are seeing more and more varieties of cultures present in their everyday practices. It is imperative that they develop cultural competence to incorporate these differing cultures, beliefs, and practices into the plan of care. Varying cultures have many barriers to care, including language, differing beliefs, no insurance, mistrust of the providers and the system, and many more. The national standards for culturally and linguistically appropriate services, or CLAS, as you see on the right side of the screen, retrieved from HIRES, focuses on these issues and requires culturally competent care, translation services, and support for these patients. Hispanics make up almost 16% of the population in the United States, and it's anticipated to increase to 30% by the year 2050, making them very susceptible to these disparities. This paper will discuss what nurses should know and incorporate into their practice with Hispanic patients across their lifespan and community. The Hispanic population is the fastest growing in the United States, and their health is often determined by language barriers, no preventative care, no health insurance, and the leading causes of death amongst them are cancer, heart disease, stroke, diabetes, and accidental injuries. Hispanics define health as being happy, in a good mood, living life, being active, as a reward from God, and it always shows on a person's face. Hispanics value La Familia, or the family, over the individual or the community, and La Familia is part of critical decision-making, especially when it comes to healthcare. Respeto, or respect, is another huge part of this culture and implies a mutual respect. This is based on authority, age, sex, social and economic status, and can hinder the patient asking questions because they see the physician as an authority figure. One of the most important qualities is confianza, or trust with the healthcare. With healthcare providers, because without this, the patient and family might withhold information. Hispanics also rely on spiritual beliefs, and many are Catholic. They practice daily devotionals, rituals, prayer, and may wear religious medals. If a patient is dying or very sick, they may ask for an anointing by a priest. A synergistic view is taken and expressed as a continuum of mind, body, and spirit, so the family may request folk medicine, which is a belief that illness is caused by an imbalance of hot and cold, so we must avoid extreme temperatures and create a goal in the plan of care to restore a balanced temperature or harmony and balance. Many Hispanic patients will seek care from brujos or brujas, which are witches and wizards, herbalists, bone setters, midwives, and sobros, or something like a physical therapist. As you can see to the chart on the right, there are some different herbs that are used, or folk medicine and remedies that are used to treat different diagnoses. This was retrieved from myth. Communication is also key when caring for a Hispanic patient, so a translator is a must. They should be the same sex as the patient and must be formally introduced to provide respect. They should sit close by, no more than 2 feet away. Use indirect eye contact because direct eye contact is considered very disrespectful. All education and discussion should occur with the translator present to prevent any miscommunication. And any questions about sexual activities, alcoholism, or domestic abuse should be directed at the translator, not the patient, to avoid embarrassment with the patient. Childbearing is an experience that is individualized not only by culture but by the person. This process is viewed differently by varying cultures, and it is not only the nurse's responsibility to understand this, but to be aware of their own beliefs, because this affects the level of care the patient will receive. An individual's culture begins to be defined at childbirth, and being able to practice accordingly is imperative. Many Hispanics believe in the holistic approach to health care in childbirth. The woman is the primary caretaker, and being a mother is considered the most important role for a woman. For many Hispanic women, the child's birth is their first doctor's visit, so they know only what the family has taught them about prenatal care and birth control. Pregnancy is considered a hot condition, so foods that are hot are not allowed, so that they maintain a balance of hot and cold, and it is important to provide cold meals high in protein. Again, communication is necessary with the patient and the family that is present, so a translator should be provided, direct eye contact should be avoided, and the oldest male is again the ultimate decision maker, and this shows respect. After giving birth, the mother will remain on bed rest for 3 days. Men typically don't see the mother or the baby until after delivery. They typically do not go into the delivery room. Breastfeeding will not start until the 3rd day after birth because Hispanics believe the colostrum is bad milk until then. The mother's legs should be positioned close together after giving birth, and her head and feet should be protected from cold. As far as a newborn, you should always touch the newborn when speaking about, to, admiring, or look at them. Hispanic children are considered the continuation of the family and an extension of the family's values. Children under age 18 make up 34% of the total national population, and they are uninsured and lack preventative care services. Children are typically taught to respect their elders and stay quiet unless spoken to. Children of failure to thrive are thought to have mal de ojo, or an evil glance that delivered X, and is traditionally treated with a healer. Providing interpreters and involving the family in education as well as community workers, or promotores, is a way to bridge the communication gap. Hispanic children are 4 times more likely to have poor or fair health and dental health, and 6 times more likely to lack insurance than other cultures. Oftentimes, these children are eligible for S-chip, but the parents do not understand or are afraid to ask due to fear of deportation if they're not a citizen. But parents cannot be deported for this, and it is imperative for the nurse to educate these families about these laws. Offering transportation to and from appointments is another way to help these children get the preventative care that they need. Continuing this non-judgmental and trusting relationship is as important with children as it is with adults in this culture. Caring for Hispanic adults is all about respect and family. The oldest male is the ultimate decision maker, or also known as machismo, although many times the family will be consulted prior to any decisions on medical care and new medications. The male or husband should always be addressed first with an interpreter, again avoiding direct eye contact. Understanding that this level of respect for the family will in turn warrant respect for the nurse and will build the level of trust necessary to provide adequate care. 43% of Mexican Americans are obese over the age of 20, and 11.8% have diabetes by this age. Education is imperative using the teach-back method to ensure understanding. The elderly, over 65, tend to share pills for financial reasons. They are less likely to ask for help or let anyone know they are sick, especially the males, due to the machismo role. So by the time they get help, they typically have multiple comorbidities. More likely, they are just going to nod their heads in agreement when the nurse or physician is speaking to them, even if they don't agree, understand. The statements or questions are incorrect, which will lead to non-compliance, again, making the teach-back method important. In the event someone is knowingly dying, a priest may be requested to come in and perform an anointment, prayers, and rituals to help the dying patient pass into the spirit world. It is believed that if a person lived a good life, they will return as a good spirit, and if they lived a bad life or a dishonest life, they will return as an evil spirit. Hispanics focus on family first. Most communities are comprised of families, such as the mom and the dad, the children, the grandchildren, brothers and sisters, aunts and uncles, and nieces and nephews. In the Hispanic community, there is typically no primary physician, which contributes to the lack of preventative care, as was discussed previously. They do typically have a healer present and an elder in the family who will speak, or the eldest male will make the decisions on whether seeing a physician is necessary. In conclusion, it is imperative for the nurse caring for the Hispanic patient to implement the patient's spiritual needs into the care plan, to avoid direct eye contact, to provide a translator of the same sex, to be aware that many illnesses are treated with herbs, to be aware of these herbs and if they contradict any other medications the patient is taking, and that many diseases are seen as misfortune from hexes and wrongdoings. When providing care, the nurse should implement kindness, respect, and allow for the patient to maintain their modesty. As with any patient, treat them as an individual. But remember, Hispanics make decisions as a family, and it may take time to decide on treatment. And these are the references where I got all my information. Thank you.